Hey, it's Dr. Day at Mountain Movement Center. We went over a neck treatment in a previous video. Now we're going to go over a low back treatment and exam. The reason we're doing these videos is to dispel some myths so you can get an inside view and what a more functional chiropractor takes a look at. We're going to look at the balance of John's low lumbar spine, pelvis. This is his pelvis, his sacrum, which is part of his pelvis. These are his ilium and ischium bones, and his hip joints. You have to have synergy in all of these joints. These swivel this way. The sacrum goes up and down, but also moves at diagonals. And then the lumbar joints, they love to go front and back with a little bit of side bending and rotation. A lot of people have low back pain, but it's not always where they think it's from. So we're gonna dig into his left-sided low back pain and figure out where it's coming from. So in a previous video, we found his shoulder blade was drifting up and that all the rib joints are tighter on this side, and he has to lift a lot with his arm out away from his body on this side. So that is a huge part of the problem, but we're gonna go in depth here. First with postural assessment, and I'm right at the top of these bones, the ilium, and we put our hands here and we can see that this one sits higher. Now a body imbalance, one hip doesn't sit higher, so we have to ask ourselves, why would this muscle, it'd be as if this muscle, if I wound his shirt tight, it would lift the hip higher. And we're gonna do some detective work to figure out why that would be. So we come in, one hip's a little higher, and his whole pelvis kind of likes to rotate this way. So it's rotated around this big, here's what's cool, it looks like a bowl. It's where all your organs sit, and it's really important that bowl is central, stabilizing your whole body. And it kind of comes up like an archway, and this joint packs into this joint, and so it needs to be synergistic. If one's higher, you can guess stuff's gonna happen. So first off, we know from where he pointed, that's his Quadratus Lumborum. It's a four-sided muscle that sits right here, and he's got a big trigger point or knot in it. Then we go to check his sacrum, and we can feel that on the left side, it doesn't want to move up and down as well as it does on the right side, as well as his ilium. And we'll just lift it up here. He's got more muscle activity here too. Okay, so now I'm gonna have you bend this way, and we're palpating the muscle to see if it gives. This QL definitely didn't want to give all the way. Now to the left side, great range of motion there, plenty of bending. Now I'm gonna grab your hip, rotate to your left with your body. So like more like this way, there you go. And then other side. Good, and back. Now bring your left knee up, stand on the right leg. And we're just feeling to see if his SI joint moves. And back down, and back up, and back down. And now the other side, and that side, the SI joint, sacroiliac joint, you can bring it down, moved a lot more. This hip joint is supposed to move back and forth as we walk and move, and they're supposed to together on a slight diagonal swivel like this as we walk, while this is going up and down and kind of going with wherever our hips are going. So we're gonna go one step farther now. Can I have you balance on your left leg for me? Okay, and then on your right. So that we definitely see there's some balance limitations on his right hip. He works much harder and kind of shifts his hip out. So this hip can be overworking to compensate for one gluteal that's not firing. And we see that, but we're gonna prove that point and really check our work with a couple different moves. Step back a little bit for me, John. And you're gonna lunge towards me. Nice and slow. Okay, and then that side. So that side was strong, patent, like the movement was very smooth. That side he had to work a little harder on. It's subtle, but with an athletic person like himself, that can make all the difference. So we're gonna after the treatment, teach him as much activation exercises for his right glute, because if I can't balance on this leg, my brain subconsciously is like, we got to do something about that. So you'll just naturally shift your weight over and use the other hip. So we've already got some detective work done. We're going to give him exercises to strengthen the shoulder blade and the right glute. What's interesting is when we walk, there's a chain of muscles that fire across like this. So there might be a whole issue with this sling of muscle activation leading to here and here. So let's go on your belly. We kind of got a good clue. We're going to treat the Quadratus Lumborum, the sacroiliac joint. While he's laying down, I can get a better idea with what other joints. So we come in, and that is L3, L2, L1, definitely. There's lots of bouncing and moving, not much on the L1. L2, same story. L3 starts to get better, and L5 isn't bad. Then we come to the ilium. So here's what I'm feeling. If I lay it over top, and these three joints were not swiveling and moving, as well the local muscles that attach into them, the Quadratus Lumborum, were tight. So we're going to get right into that. Now we're going to check here. And that's just not enough sacral motion. We need more sacral motion there. He's got great range on that side. Just a little tighter. Again, it's subtle, but definitely a tighter quadricep and hip flexor. So we're also giving stretches for that and work those. And the whole attachment points into his left sacrum. There are deep muscles that all meet here and converge at these spines, at these protuberances, and we're going to work all those muscles as well. Piriformis muscle, they're called the deep external rotators. And now I kind of palpate and mimic the motion, and I can definitely feel give and motion and stoppage. So we're definitely going to adjust the sacrum and the ilium and L1. So this table is really cool. It was typically invented for treating discs, because as the table goes up and down, you'll see the lower body drop, and it creates an opening which gives space to a herniated disc and can heal disc herniations. But we take it a step farther, and I've turned it into my kind of dynamic myofascial release table as well. So we come right into that Quadratus Lumborum, and we're doing fascial release, taking the muscle from the shorten to the lengthen position. We'll even slow it down a bit. What I'm doing is creating tension, and as it goes shortened, I can build up a ton of tension, and as it lengthens, that muscle stretches or elongates under my pressure. And we can he had trouble bending this way, so we're kind of mimicking that bend. I'm backing up my fingers just to keep my hands healthy. But I'm creating traction and I'm releasing. How's that pressure out of 10? What are we at, John?
1.
Nice. And we're holding right on the side of the QL. And I get a little gymnastic sometimes. There is a handle that you can hold to move this, but I like to have both my hands involved in the soft tissue. Right here's our main prime knot. And once we find it, that's your spot, right? So over 9 years of treating, you just finally get a feel for these things, where that is. And then we're just opening that muscle, shorten to lengthen. And his Quadratus Lumborum isn't supposed to be doing this much work. It's not supposed to be this tight. But we can know from his job, it probably has to compensate. So we're just releasing all that fascia and that muscle spasm. Now it still wants to hold on like right here. So nice deep breath here and out. And we're just taking the muscle from a shortened to lengthened position. This can be transformative for chronic back pain. I've seen so many people who've tried adjustments, they've tried injections, and no one's really mapped out the trigger points And the trigger points here can radiate pain, it can entrap nerves, and so the QL is sitting here, and you can see the referral patterns that can travel all the way into the buttock. So people think they have sciatica, they've gotten MRIs and see disc herniations, and then we go in and work the trigger points and map those out. The other thing we're really passionate about is finding the true cause. So if we only came in and he told me where it hurt, and I did some trigger point work and I adjusted, that would work for a lot of folks. But if I don't address the weak hip, the tight front of the hip, and the scapula, we're not getting to the true cause and really linking up all the different kinetic chains of the body. Nice deep breath here. Good. Now it's starting to let go. I forgot this part, but typically we start with this percussion instrument because it can do a really good job of turning off the muscle. This was invented by Dr. Fulford, a doctor of osteopathy, who went on to inspire Andrew Weil to become holistic, or Weil, I can't remember how it's pronounced. But he believed that the entire body was fascia and nerve signaling. And if you could release the fascia, that the body's ability to heal itself through the nervous system. So it's a similar theory to acupuncture, chiropractic, osteopathy. And what we're doing is hanging right on that knot, and it's finally letting go. Great. And you can see all that blood release to the area. And then we're going to just come in. We're going to go directly over the spine of the spine here, the spinous process. And what we're doing is, as I'm placing my hand here, the disc below it gets some space opened up. So anybody that does manual labor, we want to make sure that we decompress their spine a little bit. And so the joint below where I'm pressing, you feel that opening, that stretching, John? And so it's, can't say it's the most comfortable thing in our treatment, but it really does good for making sure the discs stay healthy. Good. Now the sacrum, we're going to come in, we're going to apply front to back pressure because we know that's what it's designed to do. We're going to lean over into the left side of the sacrum. I like to tell people this is like a little diving board, and it's supposed to go up and down. The tucking and releasing allows for the ultimate balance of biomechanics for your pelvis. Here he's got great motion, here he doesn't. So we're just going to do a couple pulses in there to get it moving. And then we have this drop table, and it's very loud, but really it's just giving me a little extra velocity in that motion. There's a really cool paper that came out of medical doctors that did manipulation to the sacrum, and then they showed it change the tone and the firing to the pelvic floor muscles and to the muscles here, the external rotators. Now we're going to get this one involved. So it's loud, but it's really actually quite gentle. Very good for pregnant women or areas that, you know, feel really tight. So now we're going to do the adjustment on L1. Lay on this side for me. And the reason we have to lay on the side for the adjustment of this pelvis and the lumbar spine is the orientation of the joints, especially in the pelvis. They're angled this way, so I can't adjust them unless I'm really leaned over. But if I put him on his side and then slightly roll, that joint angle all of a sudden is facing right at me. And I just place my hand right on that ischium. And it looks crazy, but what we're doing is my body drops to deliver speed through my hand. So I'm not dropping on him, I'm not pressing on him, I'm just like that. You felt that release, right? It was a good one. We're also going to do a sacral tuck adjustment here, more as a mobilization because we know that's so tight. Now while we're here, we're gonna do some deep tissue right at these attachment points we found. Let me know if this is painful. Nice deep breath. So the sacrotuberous ligament. Okay. We'll drop it back. Right to there. We're taking them through their dynamic motion because as long as they stay tight, they're going to pull and lock up the sacrum that we just worked on. Great. Okay. Now the last area we need to get is just L1, right on the button. And so we come in, and that one didn't really need an adjustment. It must have been a lot of trigger point. Go face down for me. And one way we can get that, come back, is just a little front to back. Remember, the spine loves front to back motion. Great. Okay. So last but not least, we're gonna treat the front of the hip, but first let's come back and check. Wow. Big difference. The hip is actually moving. The sacrum's not blocking the ability of this leg to lift. Let's check here. Big dip, well, that one was fine. We come in here. It's bouncier, it's released a lot, but we need to just, as we audit this, we need to get this to release a little more. So what we'll do for this one, lay on this side again for me. We'll get a little bit more dynamic with the stretch. You're gonna shift this shoulder back and this one forward, and you're gonna reach your arm overhead. Good, and you're gonna bring this forward, the knee forward, and shift this hip back. Then we'll drop this way off. And we can get a pretty, now we're actually getting to drop this hip. And lift the leg up for me. Up, 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 up. And big stretch. Let me know if it's too much. What are we at number-wise? 1. Okay, and lift up. And so we're hiking the hip. I can feel the muscle activate under my thumb, and relax. And so that's a deeper stretch, and we're gonna show him homework to stretch this way as well. Great. Now in a full treatment, we would release the hip flexor as well in the quadricep. We'll save that for another video. And feel free to watch. Go ahead and sit up for me. Actually stand up, we'll recheck our posture. So we checked the hip level, there's definitely a change. This is still a little tight, but it has improved by about 50%. So we're really gonna work with him on strengthening the gluteus medius, G medius, glute maximus, and his one leg balance. Because if he stands here, then there's gonna be congruency and these muscles won't have to overwork and lock up this area. On top of that, we gotta strengthen this, because as long as this is like this muscle has to try to do some kind of correction. So that is the bigger overarching picture. Then we're gonna do some exercises to link up the scapula to the glute. Things like a bird dog, which is firing the right glute and the left shoulder blade muscles. So I hope you enjoyed it. If you have any questions, feel free to ask me anything in the comments below. And we're at Mountain Movement Center in Greenville, South Carolina. And we'd love to show you our more comprehensive approach. Thanks for checking it out.